Hello and welcome to The Print Live. I'm Himani, Chandna, and I cover health for The Print. Today we are discussing why India has slipped below Pakistan, Nepal and Bangladesh in Global Hunger Index. I'll be waiting for your questions. Whatever are your queries, do comment, do send us your questions. Till then, I will give you a snapshot of the report that has been released. The report says that India is behind its neighbors in a list of 117 countries that track hunger and malnutrition. India fell from 55th rank in 2014 to 102 in 2019. The index scores countries on 100 severity scale point, where 0 is the best score, which means there is no hunger. India scored 30.3, which means that India suffers a high level of hunger that is serious. Do keep sending us your questions. Okay, we have received the first question, which says, is there any correlation between GDP and GHI, Global Hunger Index? Doesn't seem so, because the countries that have performed really well, that have improved, are the countries which in sense of GDPs are weaker than India. For instance, Nepal and Bangladesh have been lauded by GHI for their improvement in the Child Nutrition Index. Nepal and Bangladesh have been lauded for improving the child nutrition, which means that the correlationship between the GDP and GHI is not that strong. We have got our second question, which says, what are the parameters for the index? So of course the parameters for the index are child stunting, undernutrition, child mortality. Yes, so these are the parameters, undernourishment, stunting and child mortality. These are the parameters on which India has been ranked, and I would like to tell you that in terms of all the 4 parameters, we have ranked very poorly in terms of child wasting, which means that age appropriate weight. Our rate is very high, which is 20.8%, whereas in terms of child stunting, we stand at 37.9%. And India is just able to give 9.6% of all children between age of 6 months to 23 months minimum acceptable diet, which reflects very poor on us. Which organization released the report? So there is an organization which is called Wealth and Life and Concern Worldwide. This is a Germany-based organization, which is a private organization for the development and humanitarian aid. Where have we performed badly? Of course, I just told you that we have performed badly on all of the parameters, from child wasting to child stunting. Child stunting means chronic malnutrition. We have performed very badly on all these parameters. In child wasting, which means the weight of the child according to his or her age is very weak, is very less. Our rate is very high, which is 20.8%. In terms of child stunting also, which means chronic malnutrition, we stand at 37.9%. Child stunting and child wasting, these are seen in the categories of children below 5 years. So among the total children below 5 years, 20.8% of children are suffering from child wasting. Their weight according to the age is very low, whereas in child stunting, which means the children below 5 years, they are suffering from chronic malnutrition. The report also highlights one of a very disappointing fact. The report says that in 2015 and 16, 39% of households had no sanitation facilities in India. It also says that open defecation is still practiced in India. This actually questions the government's Swachh Bharat Abhiyan, which is one of the flagship program under the Modi government. The another question says, which countries have improved? I've told that the countries that have improved phenomenally and that have been lauded by GHI in the report are Nepal and Bangladesh. They have performed well in terms of improving the child nutrition status of the country, and it seems so that there is not very strong connection between the GDP and the GHI. What is child stunting? Child stunting means a child suffering from chronic malnutrition. The growth of the child is lagging behind the actual age of the child. 10 years down the line, 10 years ago, the child stunting rate in India was well above 40%, which means the children below 5% of age, 40% of them, more than 40% of them were suffering from child stunting. Though we have managed to reduce the rate to 35%, the rate of fall in child stunting in India has been very low. In a decade, we have been able to reduce a very few number of, percentage. Akhil Paul asks, how to evaluate our rank? What can the common man do? Akhil, what a common man do. So it is all about your earning power and your spending power. So it is about giving your child the best possible diet, the diet that is required at the appropriate age. So it is not about a common man, it is about the government to make all the ends meet and to provide the nutrition to all the families who fall below the poverty line, who are not able to eat a good and proper diet. So I don't think that much is in hand of a common man. It is about the government to make all the possible resources available, including the jobs, so that our per person spending increases. Sunil Tyagi asks, what is the authenticity of organization preparing such data? How comprehensive is it? Sunil, Global Hunger Index is not new. We have been relying over this index since last so many years. I will give you some of the scores that India has achieved in last few years. So, the number of countries participating in this index have fluctuated over the years, and India ranked 55 out of 76 nations in 2014. India stood at 100 out of 119 nations in 2017. India ranked 103 out of 119 nations in 2018, and the latest one is India stands at 102 out of 117 nations in 2019. That's the latest one. I will also tell you that Pakistan ranks at 94, whereas India ranks at 102. Bangladesh ranks at 88 and Nepal ranks at 73. Is it because of government's policy? What should the government do? How to improve it? Of course, the government has to take the charge of it, because as the last question asked, what a common man can do. Of course, the government can only increase the spends on making the nutrition and the diet available to the people who are unable to afford it, who are unable to meet their both ends. What do you think India should do to improve the rankings and, more importantly, improve the quality of life in India? As I have briefed you earlier, that there are 4 parameters on which the ranking has been calculated in terms of child wasting, child stunting, child nutrition and child mortality. India has already been working. There are a lot of other social programs that the government has undertaken, even under National Health Mission, which is one of the India's largest flagship program. Government has undertaken a lot of drives, and we have actually improved on all those parameters, but the report is a reality check. It tells us on the ground that we need to do a lot more, because we are not doing at the speed which is required. As I told you earlier also, in terms of child stunting, India was performing very badly, and in 2005 and 6, India was ranked, India had over 40% of children which were below 5 years suffering from child stunting, which has now come down to 35%, but the fall by just a 5%, 10% is something that we don't want. We want a bigger fall. We want to reduce these rates more rapidly. Keep sending us more of your questions. The another question says, how can we improve this condition? Again, I can only say that we can improve these conditions by investing more in the nutrition and child safety and security, also for the maternal health, because from the mother the nutrition will pass on to the child. When the families will have enough to eat for themselves, they'll have good money to spend on the nutritious diet, they will have a clean environment, then only this will be possible. The report has particularly mentioned that open defecation is still prevalent in India, and open defecation is one of the reasons for high mortality among children. So these are some of the parameters that government should take care of while government is running Swachh Bharat Abhiyan, where this has been popularly said that in India now open defecation is no more prevalent, at least in the urban India, and government is still trying to eliminate open defecation from the rural household. This report says that open defecation is still prevalent, and it also says that in 2015 and 16, 39% of households had no sanitation. So this report is a kind of a ground reality check, and the government needs to consider all the parameters that the report has highlighted. Has Manreka helped in the better ranking? So here we are not actually seeing better rankings. We are in fact seeing that we have fell below the other neighborhood countries, where Pakistan, Bangladesh and Nepal both have ranked better than India. Pakistan stands at 94, whereas Bangladesh stands at 88, whereas Nepal stands at 73, and India stands at 102. This means that India needs to put more efforts than what we are doing presently. We need to put more efforts. Send us more questions. Okay, the another question says, is it because of government policy? How should we improve it? Government has put several policies in place. In fact, they have also highlighted, for instance, NHM, National Mission. These policies are already in place. These policies are already there to tackle the issues of child stunting, child wasting, child undernutrition, child mortality. But this report says that we need to do much more than what we are doing. Send us more questions. I will repeat that India, the index scores countries on 100-point severity scale, which means the more near you are to 100, you are performing badly. The more near you are to 0, which means you are performing very good. There is no hunger in the country. India scores 30.3, and which means that India suffers from a severe level of hunger. Thus, I am Himani Chandna, and do subscribe to our YouTube channel for more such videos.